Welcome to NurseEdScholar. Now, one of the most common respiratory traps on nursing exams and the NCLEX is confusing COPD exacerbation with pneumonia. Now, both conditions involve respiratory compromise, both can cause shortness of breath, and both may require oxygen therapy. However, the underlying problem in each condition is very different, and the safest nursing interventions depend on understanding the difference. The NCLEX often presents these conditions in prioritization questions, asking nurses, to determine which patient is most unstable or which intervention should be performed first. So in this lesson, we're going to break down the key differences between COPD and pneumonia so that you can recognize the patterns the NCLEX expects you to identify. So by the end of this lesson, you'll be able to, tell which patient is experiencing oxygenation problems, which patient may be retaining carbon dioxide, and which patient is at the greatest risk of respiratory deterioration. So let's begin. So why students confuse COPD and pneumonia? Okay. Most students confuse these two because actually both conditions involve difficulty breathing. And so let's see the difference. Okay. So, like I said, COPD and pneumonia, the primary problem in each one of these is different. COPD is primarily a ventilation problem, and pneumonia is primarily an oxygen problem. And really understanding the distinction between the two will help you determine what symptoms to expect, what interventions are appropriate, and which patient may actually deteriorate first. The NCLEX frequently tests your ability to recognize which respiratory process is failing. Now let's start with COPD. Now remember, COPD is a ventilation problem. Okay. So chronic obstructive pulmonary disease causes chronic airflow obstruction. So, for example, by excessive mucus production. Okay. And it makes it difficult for patients to move air in and out of the lungs. So over time, COPD patients often retain carbon dioxide. So if you remember in the ABGs, this will cause respiratory acidosis. And this is because of chronic CO2 retention. Now, because these patients adapt actually to elevated carbon dioxide levels, their respiratory drive may become influenced by oxygen levels rather than carbon dioxide levels. So, if you remember in the hypoxic drive video, this is what's happening. So think about it. With your COPD patients, we tell you to try to, you have to really be careful with oxygen because if you give too much oxygen to a COPD patient, it will actually cause them to breathe less. So they're going to slow down that breathing. I would hate to say stop breathing, but if you give them too much high volume of oxygen, you will stop them from breathing because, like I said, these COPD patients are influenced by oxygen levels, not I'm sorry, not CO2, carbon dioxide levels. Okay. So let's see how your patient will look. Okay. So clinical characteristics of someone with chronic obstructive pulmonary disease or COPD. You may see your patient with kind of chronic shortness of breath. They're going to have a cough. They're going to have that barrel chest, pursed lip breathing, prolonged expiration, and they'll be using their accessory muscles. And you may see some finger clubbing. COPD patients often appear, to work hard to breathe, even when they're unstable. So you have to be careful with these patients. You know, COPD primarily, like we said before, affects ventilation. So nurses must be really careful to monitor for signs of CO2 retention and respiratory fatigue. Now let's look at, signs that's showing you that the COPD patient is deteriorating. Now, when you have a COPD patient and they're starting to go down, you're going to notice increased drowsiness. They may exhibit confusion. They may complain of headache. They may be showing a decreasing respiratory effort. And when you see these, signs of deterioration, it's suggesting that there's a worsening ventilation problem, and you can anticipate a rising carbon dioxide level. Okay, so let's move on to pneumonia. Now, pneumonia is an oxygenation problem. Pneumonia occurs when there is an infection causing inflammation and fluid accumulation in the lungs. The fluid interferes with the ability of the oxygen to move from the lungs into the bloodstream. And as a result, pneumonia's primary causes are oxygenation failure. So, what are you going to see? So, the clinical characteristics for someone who has pneumonia, you will often see fever. They have an infection, right? Chills, a productive cough, crackles, or rhonchi, that consolidation in the lung fields. They'll have chest pain with breathing, increased respiratory rate. Patients with pneumonia frequently develop hypoxia, and that means that their tissues aren't receiving enough oxygen. Okay, so remember that pneumonia is an oxygenation problem. So, what signs would we see when someone with pneumonia is worsening? Now, when you have someone with pneumonia and they're just going down, they'll have a falling oxygen saturation. They'll have an increasing restlessness. Okay, think of hypoxia. When a person is hypoxic, they'll be restless, they'll be anxious, they may be agitated, and you may see tachypnea. They're starting to breathe fast, right? But unlike COPD, pneumonia patients are not typically retaining carbon dioxide, at least in the early stages of the disease. Instead, like I said before, the primary concern with pneumonia patients is impaired oxygen exchange. So let's look at a comparison. All righty. Um, and this hopefully is a helpful way for you to differentiate these two conditions. You really need to ask yourself, is this problem a ventilation problem or an oxygenation problem? And remember, COPD is a ventilation problem, ventilation failure. Pneumonia is an oxygenation problem, an oxygenation failure. So, what do we see? The pattern for COPD. We know it's a ventilation problem. The common things, like we kind of said before, but I'm reiterating it: chronic dyspnea, pursed lip breathing, a barrel chest, prolonged expiration, and possible CO2 retention. Like I said, the major concern for COPD patients is ventilation failure and respiratory fatigue. Now, with pneumonia, we said it's an oxygenation problem. So you'll see in your patient fever, chills, a productive cough, crackles or rhonchi, consolidation in the lung fields, tachypnea, hypoxia. And remember, with pneumonia patients, it's an oxygenation failure. Okay, let's do a quick scenario. And let's see what you may see on the test or on the NCLEX. So you're a nurse, you're assigned two patients. One patient has COPD. They have respiratory rate of 20, oxygen saturation of 92%, and they're using pursed lip breathing. Okay. Now your second patient has pneumonia, and they have a respiratory rate of 30, an oxygenation saturation of 85. They're restless and anxious. So which person would you see first? And you're going to see that pneumonia patient. A lot of people say, oh my goodness, I'm going to see the COPD patient first because they're thinking of COPD. It's a respiratory disease, it's a chronic respiratory disease. But however, with this patient scenario, hopefully it wasn't too easy for you. Think about it. Hypoxia, the person's going to be anxious, they're going to be restless. You see that oxygen saturation, it's 85%. So your pneumonia patient in this scenario is going to be the person that you see first. That oxygen saturation should have been a clue of 85% combined with that tachypnea, their respiratory rate is 30. They're agitated, like I said. It indicates a worsening oxygenation failure. The person is becoming hypoxic. Okay. So, remember the person, you know, is experiencing an acute respiratory compromise and it requires immediate assessment and intervention. So you really have to make sure that you assess your patients well. And you really look at your patients. When you go in your room, you look at them. Yes, you're supposed to know the diagnosis of each one of your patients, but look at the cues. Look at those signs and symptoms, and it should tell you which person is worse. Okay. Now, you know, another concept that's frequently tested is oxygenation therapy. And we're going to be talking about that in the next video, but I want to just start off a little here. Many students assume that administering high levels of oxygen is always beneficial, but it's not, especially for those COPD patients. Those COPD patients has chronic CO2 retention, carbon dioxide retention, and they're going to require careful titration, oxygenation, oxygen therapy. Remember, we talked about hypoxic drive, and this is where it comes in. If you give someone who is a COPD patient too much oxygen, it can cause them to stop breathing. Okay. So, and think of it in contrast, patients with pneumonia are experiencing hypoxia, and they're going to require high levels of oxygen. So, to improve that oxygen delivery and get that oxygen in the tissues. Okay. So, you as a nurse, you always have to evaluate what's the oxygen saturation? What's their respiratory effort? Are they having mental status changes? And then you look at, what's the underlying disease process? Okay. And let's talk, these are the key takeaways, why students miss these types of questions. You know, Students miss COPD questions and pneumonia questions because they focus on the diagnosis rather than the clinical presentation of the patient. The NCLEX rarely asks you what disease does the patient have, right? Instead, it's asking you what patient is deteriorating. And the safest answer is usually the patient with that worsening oxygen saturation, increasing respiratory rate, signs of hypoxia, or decreased mental status. And so that's it. Understanding respiratory patterns, it makes respiratory questions hopefully easier, to answer. And like I said, in the next lesson in this series, I'm going to talk about oxygen therapy and oxygen titration, including when increasing oxygen is appropriate and when it must be used cautiously. So if you liked, this information and would like additional, case scenarios, respiratory scenarios, and decision frameworks, I'm going to create a workbook for study purposes that kind of helps, nursing students kind of practice these concepts. So please visit NurseEdScholar.com for the workbook. It's in the works. For every series, I create a workbook. And if you found this helpful, please be sure to like, subscribe, to Nurse Ed Scholar so you can continue, building that clinical judgment for your nursing exams and for the NCLEX. So until next time, happy studying from Nurse Ed Scholar.